Okay, so as soon as we get the echo stopped.
Yeah.
Did you get it? Nope. Just close out the Zoom on that one. Thank you. That's perfect. Okay. So Colleen Dey is going to speak for us today. Colleen has been working in healthcare finance and administration for 35 years. As a CPA, she worked as an auditor and consultant of healthcare entities for Deloitte, and she specialized in Medicare and Medicaid reimbursement. She left Deloitte after 5 years, and she then worked as a financial consultant and Medicare specialist for Payor, the largest healthcare alliance in the U.S. Colleen wanted to prove that she could do what she recommended to hospitals, so she became a CFO for a large nursing facility. After increasing their Medicare revenues by 250% and overall profitability by 500% in 2.5 years, she decided she wanted to go back into consulting, but this time with medical practices. She started working at Carolina Family Healthcare in 2003 and has continued there on a part-time basis while working with other clinics. She founded MDC Medical Management originally to manage the staff at Carolina Family Healthcare Sleep Center, but has since added staffing, management, and consulting services for other practices. She also co-founded the Independent Doctors Organization with Dean O'Connellis in 2008. Over the past several years, Colleen has regularly renegotiated Carolina Family's Payor contracts and has learned a lot of tactics to get them to the table and to get better reimbursement. So we welcome Colleen and thank you. And now she gets to teach all of us how to do that. Okay. That's your clicker. As soon as it goes under, I'll change the screen. So that's what they're seeing, and you'll have to change it with these here.
Okay, so I change that and this.
So no, I'll change the one behind you, but if you want to point at anything, okay, the pointer is. Never mind.
Okay. 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 Well, thank you all for attending. I decided I wanted to do this topic because I have to stay on top of Carolina Family Healthcare's contracts, and I'm constantly having to do those. And I've even had Aledade ask me if I would help some of their small practices renegotiate their contracts. And I'm in and out of a lot of clinics, and I see a lot of times these contracts are so old that the rates are just horrific and nobody will do anything about it. People are too afraid to negotiate. And, years like 5-6 years ago with Carolina Family, whenever I wanted to renegotiate a contract, I would always just, ask my attorney to do that for me, and she would handle it. But it always came back to me as, well, you've got to create what you want. And I'm like, and after a while, I'm like, I know how to read a contract. I know what to look for. Why am I paying somebody for something I'm already doing? So I went ahead and created my own way to do this. And so I thought I would like to share it with you all so that you all can, maybe adapt some of this. I'd be willing to help for some of them because there's a lot of data that goes into it. It's a very data driven. So if you don't have the time or are not comfortable with constantly doing all the data, just let me know. I can also help with some of it.
Recording in progress.
Contract that you really want to know. I mean, they have And then the next slide. Okay, so when you're we're dealing with ACOs, like if you're a lot of the primary care practitioners are in ACOs, some of us are in ACO reach. And some people are in like the United Healthcare ACO. This doesn't really apply to Blue Cross because they can terminate, you can terminate all the other contracts at any time. United Healthcare was just one that says it has to be on the anniversary date. So you really want to be careful with some of those, because if your termination date is like in the middle of the year, your ACO is a calendar year, and some of them can actually state that you either you have to forfeit your bonus or you take a reduction in your bonus. So you're in a constant loop with these ACOs because you can never terminate, because if you terminate, you lose your bonus. And then so you have to make sure they go with year to year, so that, because otherwise you could end up, you just have to keep letting it renew and you can't get out of it. So be careful with some of those and read their contracts very carefully. Next slide. So then the other thing is you want to see how your advanced practice providers are going to be billed or paid. Aetna wants them credentialed individually. Blue Cross credentialed individually, they go retroactive. Cigna says you don't have to credential them, but just use an SA modifier. Medicare has to be credentialed individually. United Healthcare is credentialed individually, but I have found they don't go retroactive. So when you bring in a new APP, they go from the day that they finish credentialing. They don't go back like Blue Cross will. And Humana wants to be credentialed individually. And so the next slide is how they're paid. Aetna pays at 100%. So they pay them at 100%, Blue Cross 85, Cigna 85, Medicare 85, United Healthcare 85, and Humana at 80%. So probably just about everybody here is in network with Humana except for Caroline Family. I don't know if anybody has actually really read those contracts, but I really didn't like it. And when I asked for their fee schedule, it's Medicare and then less Medicare for certain codes. So, and that applies to commercial and Medicare. And then they want to take the 20% reduction for your APPs. So that one got me. I don't know what the bonuses are going to be, but they got to be worth a lot more than to take that kind of a discount. And especially in primary care, they were discounting codes that we do normally in primary care, and they were just reducing them down. They were paying below current year Medicare. So I thought, I don't want to get into that one. And then especially if you're a part of Aledade, Aledade, North Carolina, you saw that there was a loss, that Humana contract had a huge loss this year. So you're going through all that work for nothing. So be careful with Humana. Next thing you want to look for is your fee schedule. Is it going to be a fixed rate or is it a variable rate? So for Aetna, they usually base theirs on the previous year's Medicare fee schedule. So it's going to stay fixed until you renegotiate. Blue Cross is variable. They're going to base it. A lot of times they're going to base it off of the current year Medicare fee schedule. Cigna is fixed. It's based on their own internal pricing structure using RBRVS, and they are not the greatest either. MedCost is fixed based on their own internal pricing structure. PHCS is fixed. This is another one I don't like. United Healthcare is fixed. They go to the Medicare fee schedule 2 years prior. They won't budge on that one. Medicare and Medicare Advantages are usually current year Medicare. And just be aware that the Medicare Advantages have 90 days from the start of the year to adjust to the new fee schedule. So you're still on the old schedule until sometime in March. So they won't change the rates until then. So the next one is you want to know you're noticed. So look where, if you're going to do the termination, if you're going to go the route of termination, you want to know in your contract what the notice is, where you have to send notices, because if you term, you got to follow their instructions. So United Healthcare does allow by email, but everybody else, you have to send a certified letter to a specific address. There's somebody who allows fax, and I can't remember which one it was, but I know some of them will allow email, some allow fax, but a lot of them want it by a hard copy to the address that's on your contract. And it's kind of interesting because some of them, if you have a really old contract, it's not even the right address. Okay, so the next one is be aware of MedCost. So MedCost is owned by Carolina's healthcare system. So Atrium knows how much you're willing to accept. So they know your fee schedules. They know how much they're paying you. And remember, they have that insurance with a $10,000 deductible. So they can pay themselves a lot more money because they know they're taking it away from you all. So be very, very careful with MedCost. Okay, so whenever I go to negotiate, they're always going to say, well, first of all, one thing I haven't brought up is you have to decide if you want to terminate or renegotiate your fee schedule. So originally with United Healthcare, you had to terminate to renegotiate. And they said, that's how I did it the first time. And then the second time, at the end of my initial contract, I called them and I said, do I still have to terminate? And they're like, oh, no, just send us your offer what you want. So fine, because I was 120 days from my termination. So I sent them what I wanted. And this is how they responded. I have to start on December 1st. So I sent it in on 2020, which was COVID. So I sent my offer in that first week of December. They waited all the way up until January 29th to send me an email saying, oh, we think you're fairly compensated. Guess what? The next day my contract rolled over. So like, I'm not doing that next time. So the next time, the next year, this time I sent my termination letter in. But what I did before I officially sent it in is I sent it to the contract person that I had on file. Or no, I think I just sent it to the Southeast contracting team, just sent it to generic. And I just said, I sent the letter to them. And I just said, would you please verify that this is the correct address where I have to send my notice to? And that's when they came back and said, okay, let's talk about this. And so this time they negotiated and I had my negotiation complete after 1 week. So it was a big difference. So your cancellation or your canceling your contract makes a big difference. And then with Cigna, we just went through that with Cigna, which my attorney says I'm not allowed to explain, I'm not allowed to say anything about what Cigna did. But Cigna really screwed us up. And it was their error. So they decided to come back and punish us for their error. So they cut our fee schedule with no notice. And then, so we termed the contract and then they came back and so they said they weren't going to negotiate at all. They said, well, once you term your contract with Cigna, they won't negotiate. So you have to either rescind the contract, rescind the termination, or you're just terminated. So I said, no, we're just terminated. I'm not going to accept this stupid fee schedule you put us on. And so what happened though, is we got our patients involved. The patients mounted a huge campaign. I mean, without even publicly asking them to, just them coming in the office and talking to the providers. We had so many emails, so many phone calls, some were sending letters. Some patients said that they called every single day calling Cigna saying, I want you to you need to not let Carolina Family Healthcare leave the network. So they ended up calling me and saying, okay, rescind it and let's renegotiate. So we ended up doing that. Don't have the greatest of terms, but they did say, they said, well, you can negotiate at any time throughout the year. So, but before the end of the year, we'll renegotiate that one again. So sometimes terming does help. So yes. No, when you terminate, you have to give 90 days notice. for just about everything. And I try to give as much notice as possible because that way we can renegotiate. And, you know, and then a lot of times I'll tell the patients, where we'll tell the patients, you know, we're going to drop United Healthcare, and because we just don't like their fee schedule and that stuff. And the patients start calling United Healthcare in advance, and they're going, oh, we don't know anything about this. So the patients start in advance. So, so this is where we get into some of the data. Send me your offer is what they're always going to say. So where do you start? So you start with your current year Medicare fee schedule, and you want to compare it to the current fee schedule that you're being paid. Then you want to determine what % of Medicare you want. So you can, and so this can be, so a lot of this is, you know, this is geared towards the evaluation management codes because that's primary care. But if you're a specialist, you want to look at like surgery codes, procedure codes, you can carve those out. Do you want a different % than your E&M? So you can do that. You need to figure out where you want to be. You compare the current year Medicare, and then you want to compare your current fee schedule as % of Medicare. And then you're going to calculate the increase that is represented between what you want and what you have. And you need to see, you want to be careful because you don't want to be too greedy, because they're going to want to know why you suddenly need such a huge increase. So, so I usually write them up and say, and justify my increase. I've said, you know, the current fee schedule is below Medicare, which that happens a lot on these contracts that people do not negotiate. They just let them keep going on and on and on. And next thing you know, you're below Medicare. We incurred a 25% wage increase over the past 3 years. If a lot of you are like what we've had to do with the hospitals, competing with the hospitals, everybody's starting at like $20 an hour now. So when you, and even our mid-levels we've had to increase them tremendously too, to stay competitive and in order to attract people. So we've incurred a 25% increase. So you know, but my wage isn't, my fee schedule doesn't reflect that. If you're participating in an ACO, then you've had to add more staff in order to satisfy all those quality measures and make sure everybody gets their well visits and all that. But again, you don't want to get too aggressive because a large increase will also impact patients with deductibles. And you want to get the patients involved. So the patients will send the emails, phone calls, send letters. I mean, in the past, I've even sent like a generic letter, like a form letter out and just said, you know, just adapt this and send it to this address. And a lot of them will do that. If you're participating with Novant's CIN, you can get recommendations from Novant. So I did that with Cigna because because Novant likes our practice. And so when I told them we were going to be leaving Cigna, they said they would give us a recommendation, which they did. So that helped us out a little bit. So you can also, one of the things I like to do is I research what the payer is paying other physicians, if possible. And I know 2 payers you can do this with. You can do it for Blue Cross and United Healthcare. Blue Cross, though, and it's probably my fault, but Blue Cross took their pricing policy offline for public. You have to be a Blue Cross of North Carolina policy holder, of which I am, so I can still do that. So I still go in. So I look in as find a doctor. And if you haven't done this, this is what, this is an example of, and you, okay, so this is United Healthcare. So, and I'm just searching under, searching for Charlotte area, primary care physician, and for you specialists, you don't recognize code, but you know, primary care will. So if you look at this, the one that is wellness visits, established female patient 40 to 64, which is our code 99396. See how they have a range of 715 to 1,127? I bet there's not a single person, single independent practice that gets paid anything close to that. And if you go drill down and say, see full estimate, it's going to tell you for every primary care practice, it says $1,127 is how much your actual cost is going to be. There's no way. I mean, they're including immunizations and all that, but no, not even close. I mean, it's so to me, I like to use this as, you know, if you're going to advertise that this is how much I'm getting paid, then I think you need to pay me. So when you translate that into office visits, so now they have, this is an office visits. Again, this is in primary care. And when you're looking at these codes like 99214 down there towards the bottom, it's 159 to 204. I mean, our fee schedule is not in that range. So, well, wait a minute, that's not the best part. I like the specialists. So let's see, now this is still primary care. So here's our new patient visits, how much those are. And some people, you can actually, and when you click on view full estimate, it really will give you the real price. I was shocked. It had our prices in there. But here's your specialists. So this one I thought was pretty good. So your specialist for $99214, you get $353. When I clicked on you, Dr. Liu, and I said see full estimate, it said you get paid $353. So they're advertising that you get paid this much when you don't. So I kind of like to, if you're gonna say that I'm getting paid that, don't you think you should pay me that much? So I do that a lot. And then I also do it with Blue Cross regularly. So I know who gets paid 160% of Medicare, which hospital gets 180% of Medicare, which hospital gets 190% of Medicare, who gets 150% of Medicare. I do it. I just go in and I start calculating them out because, sometimes I just want to know that stuff. And that's why I kind of laugh every time Aledade says, we can't share this information because it's proprietary and everybody's got a different fee schedule. Like, yeah, I know what they are. I can go on Blue Cross and look them up. So, but this is how, so when I finally am down to working on some of this stuff, so this is how, again, it's data driven, but this is how I figure out my fee schedules. So like here, I just have an example number one, and I just took a payer that has like a fixed fee schedule, like PHCS or MedCost, what their current fee schedule is compared to current year Medicare. And then, as the actual compared to current year Medicare, and you can see on pretty much all the established visits, they're below Medicare. And this is not real rates. These are just things I made up. So, but this, so I said, well, if we had them pay 120% of Medicare, we have some big increases, but at least it's bringing them up into reality. Because you can't sustain an office on those horrible codes. But then you can see, even if you go all the way up to 140% of Medicare, how large the increase is. And so I know these payers don't want to pay that big of an increase. So you've got to be, you don't want to go too far to the end, but you don't want to give them too much. Whatever you ask for, you're never going to get. So give them something a little bit high and know you're going to have to come down because they will never give you what you ask for. So that's kind of how I look at it, is try to figure out which one I want, which one I can justify. So I'll do it that way. Or, and again, I'm making these things up as an example of a payer. And so this is an example of a payer that is paying off of a Medicare fee schedule. Because you can see my actual compared to current year Medicare is 123%. And then if I asked for 130% of current year Medicare, how much of a difference it is. So in here, they're more likely to accept, going to 130% for a 6% or 135%, but then they're kind of pushing them to go to 140%. But here I would probably start at 140% and expect that they might go to 130%. But again, you have to justify it. They're going to ask you, why do you need this increase? Or they won't ask you, they'll just reject it. I volunteer that information and then I push it.
All in writing, like just letter to the.
You need to, one of the things you can do for these multi-year contracts like Aetna, United Healthcare, is ask for an increase every year. So you can request whether you want a percent of, like for this year, for the first year of the contract, you want 130% of Medicare. For the next year, you want 135% of Medicare, stuff like that. You can ask for that. Or if they don't want, or you can say, well, then you need to adjust to the Medicare fee schedule. So you have to adjust once you're adjusting to the current Medicare fee schedule each year so that you're not 3 years behind like United Healthcare wants you to be. Or you can ask for some combination of both. Ask for what you want, what you really want, and see what they give you. I had Aetna came back and gave me what I wanted, and I got an increase each year of my contract. And then United Healthcare, what I did with them is, since they're 2 years behind on the fee schedule, so when I was renegotiating in 2021, so they were going off of the 2019 fee schedule, and it was 2020 fee schedule that we had the big, huge increase, or whatever years those were, huge increase of E&Ms, 24% increase of E&Ms. And it's so So, that was 2021. So I renegotiate in December of this year. So it's 2023. So we're negotiating off of 2021. I cut my contract to just 2 years so that I can renegotiate on 2021. And then for primary care, I'm kind of okay leaving it there because in 2022, they backed the EMMs down by 4%. So if I can get it on 2021 for 3 years, I'll probably be happy with that because it's going to be a while before it comes back. So, so just, you know, you can ask for those types of things and they will, and they will, you know, United Healthcare is a tough one, but a lot of them, I know that Aetna will adjust, Cigna does some adjustments, and United Healthcare is one that I'm not very happy with them. I just, one of the things before I forget to tell you this, so I was at a United Healthcare town hall meeting yesterday in Rock Hill, and we had some Novant people there, and they were asking questions. And one of the things that they said, so they represent billing for all of Novant, all of their entities. And they said that United Healthcare makes up 73% of all medical records requests. They are 20% of the market. 20% of the market, and that's for 73%. That is a ridiculous administrative burden put on healthcare providers that United Healthcare does. So, you know, they need to pay better.
Do you give them a time frame to respond to you?
Well, it's usually like 2 weeks. Like 1 week, they're usually they're responding for the first time more than 1 week, but within 2 weeks, they usually have the first answer. So, and then I usually, you know, decline the first one and then wait for a second one. But we had the last time I was with negotiate with United Healthcare, you know, first of all, just they're difficult, but they will come around if you really push them hard enough. So with the payers that use their own individual calculations, internal calculations like med cost, PHCS, and Cigna, you want to make sure you get a % increase every year. I can tell you Cigna is not going to do it. So you just have to keep negotiating every single year. And make sure your contract does include the rate increases. And don't be afraid to issue a termination. So they need you more than you need them. The termination does get attention. Again, Cigna will say, we're not going to negotiate with you while you have a termination. You need to rescind it, but you do have their attention. So, you know, they will come. I mean, for us, they came back. And the best time to issue a termination, if you can, would be right before open enrollment, because a lot of those patients have big employers and they have multiple options. You know, like Wells Fargo has Blue Cross, but they also have other plans. So if you are negotiating right before open enrollment, that payer doesn't want to lose you. You've got more clout then because they don't want to lose you at that time. Because now if you change, then there's a chance that these employees will pick another plan to follow you. So that's the best time for that. Be aware of these payers, PHCS and MedCost. They're repricers. So they have very low fixed fee schedules that roll over year to year until your contract is canceled. They are both more than 90 days average collections, and they have the lowest collection yield of all the payers. You're basically lending them money. A lot of times you're getting virtual credit cards, so you're having to pay the 3% credit card fees, and MedCost is owned by Atrium. But the one thing I really don't like PHCS because, so both of these as repricers, or sometimes they're just repricers. So what they do is they use their contracted fees to reprice a claim, send it on to the third-party administrator. And now the third-party administrator has to pay it. The third-party administrator, I'm seeing a lot of times, is not paying, or they're going bankrupt and stuff. And so you've just rendered these services and you're not going to get paid, or you get paid a year later. So we're not even a part of PHCS and have not even been a part of them. They sent me a contract recently, and I said the fee schedule was horrific, and there was no way we were going to even accept that. So we turned them down. With Humana, because I just went through Humana, their contract was for commercial and Medicare Advantage. They pay 100% of Medicare for most codes, below Medicare for a lot of codes, and a 20% reduction for your mid-levels. So I said no to Humana, and I can't remember which, since I didn't save it, but I was reading one contract that came across that, and I don't know if it was the Humana or what, because I read so many of these things, but it had to do with an ACO, and I know I was reading this one for a Humana ACO, and I think it said that they had that bonuses would be paid 18 months after the year end. And I'm like, 18 months? Like, no. So, know your worth. Are you a low cost, high quality provider? How much do you save Medicare? So primary care physicians, if you are in a Medicare ACO, how much do you save Medicare? And I know, I can tell you, I know through my ACO that we did, Emergent ACO says that we saved for 2022, we did, I think, 26%, but when I adjusted it for stratification, it's 17%. So I know that we saved Medicare 17% last year. And for all of you who are part of Validate ACO, and I have talked with them about this, and they are swearing they can't calculate how much you save Medicare. Yes, they can. And I can even tell you how to do it. So I can tell you what you need to request from Validate to figure out how much you saved. So that I don't know what their problem is, why they say that they can't, but it's very easy. It's very simple to do. So just let me know if you want me to, if you want to get that information from Validate, I can tell you how to do it. For specialists, one thing that you would be very helpful for y'all is to know if you're a preferred provider. So I pulled this off of United Healthcare. So this is just where, and this is not a big inclusive list, because this is just where Carolina Family Healthcare referred patients in 2022. But I just thought it was interesting. So we have, Amir Qureshi and James Liu are both preferred. And then we get down into here our non-preferred ENT. And when I was at this United Healthcare session yesterday, they said that this is all based on cost and quality. So if you're a non-preferred, they're basically going off of cost. So those are high cost providers. So they're saying, if you all as a specialist don't know where you stand, ask a primary care practice who has access to this information. And, we can probably tell you if you're preferred or not preferred.
Same practice. Preferred and non-preferred provider.
I know one's higher cost than the other one. One does more blood work. Yeah. Yeah. Yeah.
Can you repeat that?
Oh, the question was, what does it mean when you have a practice and you have one provider is preferred and one provider is not preferred? So you can kind of see that with Cornerstone ENT. Says it looks like they've got some preferred and non-preferreds. So it's just means that they have one provider is ordering more tests, doing more procedures than the other one. So one is considered low cost and the other one is not. And I see that a lot. The other thing, and I'm only showing this one just because Validate gave this to us publicly, but I also have this full database. They shared it with me, but I've been sworn to secrecy, so I'm not allowed to actually show you where everything is. But they shared this with all of the participants of Validate and ranked cardiology. And again, you can see Dr. Liu and Qureshi are both at the top of the list for that. And then where you see the red dots and those, anybody who's got a red dot, they're saying they're high cost, and this is coming out of Validate. And so they have a different way of measuring it. They've got all kinds of measures that they get into all kinds of things when they create these measures. So it's not just cost, it has to do with quality too. So it's not so simple the way United Healthcare is. This one has a lot more detail to it. So you have this one. So if you're a specialist, you would want to ask somebody who is on Validate, who's in Validate, where do you rank? If you're high quality and low cost, then that says a lot, and that you can negotiate with that one. So Dr. Liu, I think you should be getting paid pretty good by now. I mean, Validate put this to all of the primary care practices, and they even went and said in a meeting, everybody should be sending them to to James Lou, and we said, well, nobody can get in. Yeah, I know. This one, they have gastroenterology. This one again was shared with us. And again, I do have more detail on it, but I'm not supposed to share anything. So here they have identified Ronnie Seisner of Carolina Digestive is at the top of the list for bad. And he is also at the top of the list for United Healthcare too. So, but yeah, but here, this is where they're saying, this is where they want people to go send to these specialists. And then this one is for ortho joint, again, how they've ranked them. So, and so here you have all the green ones are a little bit further down, but they were just, I'm not sure why they were highlighting the ones at the top. So that's not in any order. So for those, for all you specialists, just, you can ask me. I've got a lot of information that most people don't have. But know where you rank. If you're low cost, high quality, then you have some negotiating power because they don't want you to leave. So let's see. But oncology and pain specialists are not ranked. No, but they're not allowed to be. They can't rank those because their specialties are a little bit different. So I think that's about it. So what is that Medicare ACO bonus worth? So one of the things is these bonuses for those of us who are in ACOs, the primary care ACOs, because I turned down Humana and everybody's like, well, you're going to get a bonus. I'm like, yeah, I'm going to get a bonus more than a year later. So after we do all that work, so what I wanted to say, okay, well, what kind of bonus am I turning down? So I looked at it as for us, I did this two ways because for Caroline family, a Medicare patient in 2022 is worth $800. In 2023, it should be $900. But everybody else, because we've got, pretty much everything going, with the remote patient monitoring, the CCM, doing the CGM, starting that soon, because we got so much going on, we're in a higher range, but everybody should be at least getting 700 from Medicare. So when I did it, if you're getting a per member bonus, annual bonus of just $100 a year for your patients, that's you're getting 114% of the Medicare fee schedule. So, and then each one, if you can manage to get $500 bonus, I don't think anybody can, it's 171%. So to me, if I want at least a $250 bonus if I'm getting 700, but now if I'm getting 900 this year and a $200 bonus is only 122% of the Medicare fee schedule. So because I get so much else otherwise, but so this is kind of how I'm determining, do I want to come back in and relook at Humana? If they're offering a $400 bonus, then I will reconsider them. So, but and I don't know how much Aledade paid for Medicare, but I know that our emergent one was averaging $265 every year that we were getting. So we were doing so if we were at 700, we were getting 100, almost 140% of Medicare. So we were doing pretty good with that. But so I think that's it. Oh yeah, no, here's this one. This is the law. And this is one where Cigna, I just want to make sure everybody knows this law. And it basically states that the insurances, if they're going to reduce your fee schedule, they have to give you 30 days notice in writing for it. And so here, this one was one where Cigna thought they were being so, they were punishing us by cutting our rate. And then, so then they turned around and so for all claims in 2022, between January and May, when they before they cut the rate, they reprocessed all of them at the lower rate, but Cigna doesn't do voucher deductions or anything. So they sent them to a collection agency, which that's how they do it, which I just ignore those because they're not Cigna. And then they did for 2021, they reprocessed them and sent them to a legal collections firm. So really big, serious ones. So in total, between the two companies, it was over $25,000. So I just got this law out and sent it over to the collection agencies, said what they did is illegal, it violated this law. they verified it with Cigna. So there's nothing that Cigna can do at this point. So they violated this law. They did not give us any notice. So just make sure if you run into a payer that does that to you, that they have to give you 30 days notice to reduce your fee schedule. If they want to increase it, they don't have to give you any notice. So.
You could just send it. And if you miss it,
No, they cannot. Read your contract. That's the other thing. They cannot read your contract. Notices have to go to where the notices is in your contract. So United Healthcare, which I have to watch, so they sent 1 year, this is on our previous contract. I opted out of Medicare Advantage. And so they sent to our billing address the contract addendum to add us into United Healthcare Medicare Advantage. And unfortunately, we missed it until like a year later. We didn't even know we were in network. And that's when I finally figured it out. But if I'd seen it, I would have immediately said, no, we're not in, that's illegal. You weren't supposed, you sent it to the wrong address. Has to be where notices go. That's why I was saying the notice, know where your notice is and what you used in your contract. So yeah, so be aware of that one. That's it. So are there any questions? Yep. All my contracts state they have to send it to our physical address. So if they send you a contract addendum and you missed it and you don't like it, then you can, and they send it to the wrong address, they're not allowed to do that. So you can opt out of it at that point. Oh. Oh, okay. All right. So
This all through the year. It sounds like you might have runs out all the time. You must have a calendar that tells you what your advance notices for each group. We're constantly kind of ready to do the next move.
well, the one you really have to watch is United Healthcare because they go off the anniversary date. Pretty much anybody else is just give notice, you know, you just have to follow 90, 60 or whatever days notice that they want. So United Healthcare is the one you really just have to watch. And I know that one. I know December 1st, I have to start. Now they're saying that to even start earlier, but when I try to negotiate with United Healthcare, they're like, no, you can't start till December 1st. So, United Healthcare is they're probably the toughest. They're the largest, most profitable insurer, and they pay horribly. And they require the most PAs, they require the most medical records. Like, oh, it's like they really need to pay better. But what I do is because, so it's data driven. So I just have spreadsheets and I just always keep them, I'm constantly adding to them. So I have all of my payers on one spreadsheet and with the Medicare fee schedule. And then I'm constantly looking at it. And then I'll know when it's, if it's getting close to my contract rollover or year end or something, I'll just issue a termination notice and contingent on renegotiation.
so do you find that works better to issue a termination notice?
Yeah.
Well, the first day I'm negotiating, they say no, that. And then you just say, oh, well, yeah, here's my termination. notice.
Yeah. Yeah. So, I mean, like what I did with United Healthcare, I just sent it to them and said, just verify this is the right address that I send this to. And I didn't issue it. I just said, just let me know if this is the right address. So, and they came back and said, yeah, it's the right address. What do you want to, you know, make us an offer and let's talk about it.
So if they don't come anywhere near what you want, you just go ahead and.
Well, that will depend. So we have terminated, but sometimes it'll just depend on, like here with Cigna, when they came back and they didn't give me exactly what I want or put us back to where we were. So, but they did say, well, you can renegotiate it later in the year. So I know that by fourth quarter of this year, I'm going to be contacting Cigna. And I've got the contractor's address, email, and I'll just ask her, say, hey, it's time to renegotiate this and get a better rate. Because they were still so angry with us at their error that they would not renegotiate. So she said that, which the contractor was on our side. And so, but they were so angry with us for their screw up that they wanted to continue to punish us. So,
What do they say, like Blue Cross or United didn't show them? What do they say? It's $700 for physical, yeah, you're only paying us, I don't know, 100, 200, what do they, I mean, how do they answer that? Then,
well, Blue Cross got mad at me. And then Blue Cross for primary care refers you to Alidade. So we can't do anything because they will just stick us on Alidade. United Healthcare, which I did not like, which is why I didn't sign up for the Alidade ACO with United Healthcare. So when one of the definitions of an ACO, an accountable care organization, is that everybody has a common fee schedule. And so if you look at Alidade, they negotiated that for us with Blue Cross. We all have a common fee schedule. But when you get to United Healthcare, they didn't. They said, nope, everybody's got to use their own fee schedule. And, and they want all this work done and they don't want to pay anything. And then that contract from United Healthcare said that during the first year of participation, no bonus will be paid for the first year of participation. So I'm like, watching Alidade going, showing how much they're saving United Healthcare. I'm like, but the contract said there's not going to be a bonus. Why is everybody jumping through these hoops to get this money saved for them when there's no bonus? So that one and again, the ACO participation was a 3-year contract and I didn't want to be tied to United Healthcare for 3 years. So, but I don't always get exactly what I want, but I get kind of close. I still have a gap with Cigna, but I'm still working on. But oh yeah, it's always got an increase. Yeah, they always come back. I mean, the Cigna one took a really long time because we went back and forth so much on that one. But again, they were so angry with us and they were punishing us for their error. So they originally didn't even want to negotiate with us. They were happy we termed until our patients called them. So, but I've always gotten an increase. And some of them I've got some pretty good ones. Right now, I learned Aetna is definitely looking for independence now because they got the state of North Carolina contract in 2025. So they need more providers to make sure they have enough to handle that. So that's a good time now to negotiate with Aetna. They were very favorable.
So if anybody needs assistance doing this, who can help?
Well, I can help. And I can teach you how to do it. And so a lot of it's just data driven. It's just time consuming is really what it is. Writing stuff out. I've got a lot of it already completed, so it's pretty easy for me. But yeah, I can help. I can share some data that I have. So, but yeah. Yeah, I was going to go pull all that together and I just ran out of time. So yeah, I've got it. I've got it all on my email. So I know who they are. Yeah. So
do you guys have any questions for Colleen?
The reason why I'm so low cost is my fee schedule is so bad.
probably, that's what's very.
Schedule, and then everything that you said, I said, what quality and cost, I said, you got rid of all the consultation codes, the costs went up during COVID, and staff, right, and they're like, this is the only other option to do it. This part of this, that was it, they would not negotiate, and it took forever for them to respond. And it was getting close to, I started more than 90 days before.
because you didn't terminate. So, I mean, again, I didn't actually terminate. I just sent it.
Started out my question.
Well, sending the actual letter in, and just, I didn't send it. I just said, hey, I just need to verify, my contract's old. Is this still the address where I need to send my this notice to?
Yeah, they like send it for holding on to the rates.
Well, and Yeah, and I know, and so that's why, because so I set my United Healthcare contract for just 2 years, and so I can do it this December to go back onto 2021. So I want to see if they're going to do 2021. They may have skipped it. So, yeah. Yeah, and I will do it again. I will we will terminate. So, and that's, I mean, we've had that. I mean, we've had negotiations that come all the way down to the very end. And before they finally give in on some of it. And again, a lot of it, the patients are calling. I mean, get some of your primary care providers to call in too, or to send letters. We'll be happy to send them. So.
Do you lose a lot of patients when you send out the message for their term?
No, I don't think we've ever, I think we just said, yeah, I don't think we've ever lost any. The only times we truly lost any patients when we should fully term, we termed, well, we actually, so we did once because we did term United Healthcare. So we fully termed United Healthcare. And so we did United Healthcare, Cigna, PHCS, Humana, all at the same time, because we just did a mass purge because we just needed to get rid of some patients and those were our low payers. So we did a mass purge and did an announcement. And so United Healthcare, we did it right before year end. So those people were already in the process of looking for a new provider when United Healthcare came back to us in January and said, no, what is it going to take for us not to terminate? So they came back to us after we did the announcement. So now I've learned, I don't send the announcement out until it's really closer to that contract termination date. So that's what we did with Cigna, is that we did not send out the announcement that we were terming. We just mentioned it to patients in the office that we were going to be terminating it, and they're the ones who took it upon themselves to call Cigna and stuff, and they did that one. But yeah, and United Healthcare, we never, this last time we never said we were terminating, but we just sent them. We asked, the contract negotiation team, because that's not who you send your termination to. So, but they came back. Every time we've termed, they come back. But the one time I didn't term and just said, we want to renegotiate it, they did exactly what they did to you. They said, we think, you're fairly compensated. I'm like, how can I be fairly compensated when I'm at the Medicare fee schedule or below Medicare, the current Medicare fee schedule? That's not, yeah. And then too bad. And then when I tried to send an email not say we didn't accept that, they ignored me and our contract rolled over. I had to wait another year. So United Healthcare is bad.
So does that affect Medicare Advantage?
Yeah, well, yeah, because you have to be in with United to be in Medicare Advantage. So we just dropped Medicare Advantage just because United, because they had the worst, they've had the most prior authorizations. So
can you take United but not United Medicare Advantage?
Mm-hmm. Yeah. So yeah, so we did that. Yeah, and we just we picked up Aetna Medicare Advantage. And so we just had all of our United patients move to Aetna. So, and I know United wasn't that happy about it. That was 100 patients for them, but. Anything else? You can send me emails and I'll try to answer them.
What email address do you want them to send to?
The Colleen at carolinafamilyhc.com. Yeah, and I'd be happy to help anybody, but I don't. You have to, if you're communicating with the payers, don't use my name, because I don't want them to know, because I just gave you all my tactics, and now they're going to start expecting some of this stuff. I don't want to ruin it. So, but this stuff does work, and United Healthcare is just taking advantage of everybody. And the meeting that I was at yesterday, that was one of my comments that I listed. That was that one of the questions on the evaluation of the meeting was, do you think all these measures that we're taking will help reduce the administrative burden for United Healthcare? And I put, yes, it will, because you just put it on all the providers, and you don't want to pay us for it. So
So Larry High asked if the slide can be shared, if we can send it to him.
Thank you.
All right,